Let's talk about some important healthcare facts. One, a large number of Americans rely upon Medicare to pay for their healthcare costs. This includes those age 65 or older, those who are on dialysis for chronic kidney failure, and those with a chronic disability. The second fact is that Medicare in its current payment form is going to destroy the American healthcare system. So as a group in 2024, Medicare plans to cut physician reimbursement 3.4%. This happens because Medicare is essentially trying to stay budget neutral, meaning it doesn't increase the amount of money coming out of their system. But unfortunately, as the population ages, grows, the need goes up. So you're essentially dividing the pie despite the amount of resources needed to take care of those patients going up. So I work for a fairly large, locally controlled hospital system, which is a nonprofit which provides services for a very large number of lives in central South Carolina. If we relied solely upon Medicare dollars, our hospital would not be able to keep its doors open. And this is true of almost every nonprofit hospital in the country. There are certain smaller hospitals which are called critical access hospitals where Medicare at least makes sure that their payments cover the cost of doing services. But in doing so, they're acknowledging that in many hospital systems, their payments do not cover the cost of doing services. In larger healthcare systems, essentially what is happening is those with commercial health insurance, Blue Cross, Cigna, United Healthcare, the hospital systems or facilities are making enough off of those patients that they can subsidize and use the excess to pay for the loss they take on Medicare patients. Seems like a great system, right? But the fact is that we continue dividing this pie smaller and smaller, and the assumption has been that we can continue doing this indefinitely. I think we are hitting a point of no return. I don't know when that point comes, but the healthcare system can't take these cuts indefinitely. The margins are razor thin. This is why smaller, locally owned primary care practices, et cetera, are not accepting Medicare patients in many cases because they couldn't keep their doors open if they do. So I think as Americans, I am hopeful that Congress will eventually see the error of their ways and adjust for inflation and build increases into the cost of health care. But right now, they're actually doing the opposite. Inflation goes up and payments go down.